first we have aging in place. Now we have healthier SG. So what do you think about this new campaign about getting healthy within the community?
I think it's about time. But we know all this, I think we spoke earlier about, it takes many, many years to formulate a nationwide program or policies. And I think I've seen this in the work. So we work actively with Health Promotion Board, running programs and stuff. But it has always been in silos. Like HPB will do their thing, MOH will do their thing. But I think this Healthier SG, it's the first time I've seen where it is a very holistic approach, from bottom, from community all the way to hospital care. And I think it really sets the mindset, both from the medical fraternity and also from the citizens' point of view of how to lead a healthier life.
So does that mean that all this while that we are not doing things right, we have to be guided to live a healthy, aged life?
No, I wouldn't say that, because, it's how we are made. Like once when we know that there is something seriously happening within your body, you tend to want to escalate it to someone who is a specialist. Like let's say if you have chest pains, you would go, oh no, I need to go and see a cardiologist.
But that's only human, right? You want to be treated by someone who understands in specific what it is, right? Or you go to someone like, maybe it's like that. Maybe it's this, maybe it's that. Or this pain, if this pain, then this is the cure, or this is what you need to do. These are all the works. If you go to someone who really understands the specifics of the pain you're going through.
But then again, they want you to go and have a family physician who has been taking care of, say, you and your family since you were a child. And that doctor would understand like your pains, your development. Let's say if you have type 1 diabetes, which is childhood diabetes, that doctor can actually manage your chronic disease. You don't have to put a burden onto the specialist or the hospital by going straight into the hospital system if you have a GP managing you.
So the new system wants us to be managed and handled at the baseline of it by the doctor who have been treating us since day one, the family doctor.
I think it's not new. I mean, we always had our family doctors, and I still go and see my family doctor. How many years really? So they know you from young, and I think that it has a lot of benefits. So I think this Healthier SG plan really just picks up on what we've been doing every day. But I think there's a lot of added elements to it. I mean, yes, the medical thing is you have your family doctor. He or she will know what you're going through. They started the data record sharing, so you don't have to carry or redo certain tests. So it took a long time. First was your GPs, then they had the price control, then they had sharing of data rather than duplication, and then now there is a pathway. But this Healthy SG goes beyond doctors. It's about nutrition, it's about chronic disease management, it's about early diagnosis, and I think it's just not at the GP. Based on that, the whole Healthy SG launch, there are different entities. You have Sports SG, you have MOH, you have Health Promotion Board. So it's a very broad but very layered approach. Doctors are, yes, your medical, but you have educators, you have health and wellness people. So basically you have your community where you live, and within that community is like having a doctor, a physiotherapist, a nutritionist, and it creates that whole mini sector. So I don't know whether they took a leaf out of like your heartbeat at Bedok, our Tampines Hub, where they start centralize all the resources. So I think it's more of centralizing care and education, because I've seen a lot of Health Promotion Board programs, they have changed. It's very program based rather than, okay, come and exercise, and then go home. Whereas now it's a lot more program based, where there's a lot of education, empowerment, and then also some exercise. I see the change, and the change has happened when they launched this program.
So according to this program in Prospect, right? So it's like if I have some issues, I go to the GP, then the GP will say, oh, you need to go to a therapist, then this is where you should go. So he'll be the first point of contact. Or if you need a dietitian, then this is where you should go.
I think he would be
Recommending.
Yeah, he will be your advisor, your health advisor, and hopefully the peripheral support services would market direct to him, or he would have the resources to say, oh yeah, we can go here, we can go there. Or your CC, your community centers would say, hey, we have this talk on. It's multi-layered
True.
I don't think the GP will be the agent selling all these other programs.
But for normal citizens, right? You go to the doctor when you have simple fevers, then it escalates to something else and say, oh, just go see a hospital. So it's still under the medical field. If we talk about the new program, then if it's multi-layered, right? We need a referral or say, oh, go find your own dietitian. But where? How? Right? There must be within that compound, within that radius or that community or within that network, we must be able to know, oh, you want to go, then it's here. Right? There must be someone who's able to direct us. And I think doctors within the community are the most trusted person, family doctors, and they should help, or they should be the first reference point to say, you go to A, B, C. Because for most of us, like people like me, what the doctors say usually is the gospel truth. So we believed him. So then if they ask, okay, you go to find a dietitian, but yeah, which one is good? Everybody wants to go to a good clinic, good reference point. See, so you see they need to play that active role for us to support the system.
Yeah, I see it one more level down. I mean, you only go to the doctor when you're not well. I don't think you go to see the doctor
When you're well.
When you're well, you don't.
But some people do because they go for their annual checkup.
Yes.
You
So
see?
unless it's all weaved into that, where every Singaporean needs a checkup at certain age, when we were kids, we have a certain milestones. And I think now, for example, like women, you go for your breast checks and all. So I think, I'm not too sure, but this framework might establish that life milestones that hey, every Singaporean,
every woman has to go for mammogram when she is 40, but every adult has to go for colorectal check.
Yeah. So I think this creates that framework which we never had, but then comes problems.
You see, you are sick, you see a doctor. I don't have issues with my stomach. Why must I go and get my stomach checked? I don't have issues with my teeth. Then I don't have to have it checked. I get it done. No need I'm healthy, then go see doctor for what, waste money.
So it's a whole process of education.
So unless, just like the vaccination, right? Like, oh, you have not done this? Can you do this check first before you can proceed to the next level? So there must be check and balances. Like the vaccination, right? Oh, have you done the first jab, the second one, and the third one, and the booster? So they're pushing it. The campaign is very strong. But who holds the stick to tell you that you need to go for your colorectal check, you need to go for your pap smear, you need to go for this?
Yeah, but why do you have to have the stick? Why can't people just go for their checks? Because it's, after all, your own health.
Yeah. For those who are conscious, who are well informed, of course they do. But a lot of us are not like most of the well informed fellas, right? That they leave the day. If I'm healthy, means I'm done. The pre-checks to them are not important. We need to have an education to tell them, do the pre-checks. So there are campaigns, but the campaigns are wide and sparse.
Yeah. So I think with this new program initiative, there will be a lot more. It will be in your face. Wherever you turn, it's about healthy living, and it's just an amplification of what the HPB or MOH has been doing.
True.
This just creates that framework which is true Why would you go for the checkup when you don't even know that it could help you, or it could save costs, or are the mammograms or checks subsidized? Or you
Yes.
can use, yeah. So I think that's where instead of the stick, then you have the carrot lah. This is the subsidy lah.
If I go to hospital, I could use my MediSave if I get hospitalized. Am I able to use all this privilege if I go to the family doctor or the community dietitian, blah blah blah, you know?
And at the same time, also there was a story on TV that says if I were to go to a polyclinic, the cost of my pills are way cheaper than if I were to see my GP for my chronic illness. Once again, can I use my MediSave?
Not everybody have good finances. Some of us are cash strapped, and they go like, I think, well, if I check, I'll be spending another $50 to $80. I can use this money to go market, right? So we need to understand the financial bit also and see how we can actually assist them. For them to come, I think it'll be harder than you approach them and say, why don't we do this check for you? So you become that kampong feel again, where you come to that blog or that community, say, let's do some health check for free. So this whole health medical staff would visit them first before to call them back to the clinic. So you must approach them first, then you pull them in.
I think I like that phrase, the kampong spirit.
Yeah.
I think it goes back to where everybody looks after each one and give advice, share knowledge, share resources.
Under the old kampong days, 70s, 80s, right? You have the Ministry of Health van coming in, driving into the kampong, say, okay, let's do free check, high blood, this, you know. So people do not know where to go because most of them are ignorant. So I'm talking about the group where they are financially strapped. They don't read much. They don't understand what's going on, compared to those who understand, who are more conscious about their health. There are two different groups altogether: the financially able and the cash strapped group, right? Like, I do not want to spend another $50 when I can use it for my kids for the next 3 days. Yeah, so the approach must be different. You cannot have one formula that would fit all.
I think they can. They have already started the free exercise. You know, I think the government felt that. I think Singapore is one of only 2 countries that provide free exercise with the belief that healthier you are, you won't go to the hospital lah. If they can have that budget, that mindset of healthier, okay, don't get sick, preventive screening can be an option, which I hope they will detail lah. I mean, it can be done. It's not new. It's just instead of exercise, you go for pre-screening, and then once you identify certain things, you get for early intervention. So it can be done, which I hope they will also lah.
It's like the Breast Cancer Foundation bus, where they have the mammogram going around and giving women from, I think, 1-room and 2-room flats free mammogram. But that is screening. There was a group of OBGYNs who want to give the same group of women prenatal or antenatal care. But then again, they're prevented because of insurance. If anything happened to these women, the doctor's own insurance will skyrocket. So that plan had been canned. So once again, unless everything falls in place, insurance, doctors, it can put a damper in these plans.
But I think this framework creates the argument, the justification for insurance companies to come on board. But the other big issue is costs, GP versus polyclinics. Can they have more polyclinics rather than GPs? Or I think the government is just working with the established network of medical practitioners, and GPs form the bulk because they are already embedded within the community. But we saw on a few days ago that cost, one cost of aspirin, although it's the same, is more expensive for the GP than poly because of the bulk ability to buy in bulk. So I think that's something that they really need to address.
Unless the GPs hop onto the same bandwagon, and it's like they get their pills from the bulk buy.
Yeah, so I think it makes sense that, and from the pandemic, we have seen how a nation can come together to bulk buy and then make sure that masks, vaccines are cheaper cost. There shouldn't be a reason why the medical fraternity cannot do the same for day-to-day medicines.
See, they have been operating individually. So for them to cluster, that's another formula which the medical side needs to work on. Then the marketing bit of it, they need to cluster and have added on services. So someone needs to facilitate the doctors. Then someone needs to facilitate the patients or the prospective patients. Then someone needs to go to the ground and educate the public. So there's so many things, and insurance companies needs to come up with policies that doesn't kill anyone to get a decent insurance.
Yeah, it's a mindset change. It's a business model change. GPs are your SMEs. They make money in various ways. They sell different medicines and stuff like that. So the model has to change. Maybe a generic tier. And then a more specialized, your perks and your fancy medicines.
Unless the government wants to explore, now we buy our own personal insurances because medicine can never be free in Singapore, ever, I think.
Why not?
I don't think that will happen. It's business for everybody. The CDA account, let's say you draw for every money that you top up, then $1 every month, or for babies, right, $5, you have that savings and plus that insurance to cover you for a lifetime. So you continue to pay that small amount of money until your retirement, right? And I think it should start young. So when we are in our adulthood, we also have insurance that cover most of our illness. It should start from young as a savings from the CDA account, because CDA is one-to-one. You top up $10, government will top up another $10, right? And there must be an extraction of that component to get insurance, one. Or when you start your working life, right, in the adulthood, then CPF will be able to buy your insurance at a minimum cost. At the age of 20, when you're all still healthy, it's a must buy, and it must cover most of it. So when you grow older, when you retire, you already have your basic insurance. Then if you want to do it, then it's an add-on. So everybody has insurance, right? It's not like, oh, I've got money, I buy. Some people believe in insurances, some people don't.
Isn't there a MediSave insurance that everyone can opt in or opt out? So everyone has insurance. It's an opt-out option. But I agree with you. I mean, insurance plays a key.
Yeah, so in Singapore, just like the US, if you don't have insurance, it's hard for you to survive if you're unwell, especially if you got cancer, right? Chemotherapy will cost you thousands and thousands of dollars. If you have dialysis, it costs you thousands of dollars. So insurance should be embedded since young. It should be an education. It should be a curriculum to say how important healthcare is from school. So people children start to understand that they need basic insurances even before they start their working life.
The problem again is when a child is born with a chronic disease, a disorder, insurance might not work. They won't cover you. Not at all.
Then the government needs to do some divine intervention to that.
Yeah, I mean that's when a disease presents itself. So I think this Healthy SG is actually before the onset of disease. Once you enter a disease identification, or you've been identified with a particular disease, then you go through the clinical intervention. I think this Healthy SG is everything before. So the whole policy is not announced yet. It's bits and pieces.
When you say everything before, that should be in your healthier years.
Yeah, but then you see the reports that came out, I think it's about 3 days ago. It says that they are targeting at people 60 and above. Why? Shouldn't it be targeting at people 20 and below.
I think they will eventually roll it out. But any exercise, no matter how old you are, I think will help. You know, that little bit can really do wonders. You know, and I think that's why they're targeting that sector first. But each one of us have one wish. All right. What would you wish to be included in this Healthier SG based on your experience overseas, healthcare? But you cannot ask for free healthcare because you know it will not happen. What would you wish to be included from your experience, or you feel that it will work in Singapore?
Oh, that's a tough one. I got so many of it. Oh.
Okay, I will start. Okay, I think I will take back the free thing lah. Because we have free exercise. We can have free subsidized programs, education.
Free is free, subsidized is subsidized.
Sorry,
There's no
okay,
free
wait.
subsidized.
Wait. We have free exercise programs. We have free educational talks. We have free health screening. Can we have free early diagnosis? You know, where it's a baseline. Like we go for our BCG jabs. We go for our inoculations at a young age, paid for. Can we have basic screenings for general diseases that men and women go through, or encourage us to go for various tests?
I think we do, because I remember that my mother was invited downstairs by the RC members.
Yeah, it's all free.
Yes, to go for her eye check, ear check, balance, but there's no blood test. It's all these, really basic.
Yeah.
And after that, she gets a letter to go to polyclinic
A follow-up.
for follow-up.
You're going to hate me for this, okay? Now, we are number one economically. We are good. We are a financial center. We are very rich. We have so much money. We have so much assets. Why can't we emulate what the UAE government has done for its people? Why can't we emulate what the Brunei government has done for its people? Why can't they take care of us? Because we have been serving them, right? They should help us when we are really in need. I'm not talking about free healthcare, but I think for them to take care of us if we really have chronic diseases is not an impossible task. We are not a poor third world country anymore. We are not a country that is moving towards the first world economy. We are in that first world region. If Brunei can do it, if UAE can do it, and some first world country can do it, we need to emulate those good things. Not everything is all about business. I think if you can take care of us, or they believe that we are being taken care of, now we are taking care of ourselves, right? If we believe that the government is taking care of us, I think there'll be a lot more in return for them from us. I mean, people may not agree with me, but it's just a wish, right? I can wish for anything.
So maybe we have the tote board, our gambling money going to social causes and stuff like that. Perhaps maybe all the ERP money that they generate gets diverted to healthcare, Yeah, I mean, like I said, there's a means. If we plan, we identify, there's a way to finance it.
I give you this example. A baby was born with some chronic diseases, and the cost for the treatment for that baby to survive, a true Singaporean baby to survive, costs 3 million. So the parents are struggling to have crowdfunding. The community is helping to get treatment for the baby. Should not the baby be getting any help from the government? It's your baby. If the baby is healthy, the baby is going to serve you in national service. The baby is healthy, the baby is going to be a lawyer, a doctor, a teacher, is going to contribute to Singapore. Why can't you see? We can start with the babies first, save the babies. I do not think it will cost even a fraction of all the reserves or all the money that that we have. If we can pay multi-million dollars for people to lead a company, I'm very certain we can get all these MNCs to scrape a portion of whatever profits they do just to help babies for a start before we extend it or expand it to some other levels of the age group. That's a wish.
That's good. That's good. Judith, the last one to end up the show. What's your wish?
My wish for the program to provide, you wouldn't want to provide free healthcare, but you can provide free screening. You can provide free referrals from the screening, and from there, you just work your way up.
Yeah. It is just a wishful thinking. The government might hear us, the government might ignore us, but I hope you will knock them, or we will nudge them, say, hey, yeah, maybe we can do this. Or maybe this will be an argument in the next election to fight for. Fight for your people. Fight for us. We will definitely support you.
Hope they listen.
I hope so.